and welcome and to FBL Broadcasting. Lovely summer Easter day as always, in a special situation like this, and I'd like to welcome Mayor Mike Smith. Hello Mike.
Hi Martin, how are you doing?
I'm getting there, mate. Got a little bit of a cold, still carried on from last week it looks like, but other than that all fine. Kids are fine as well. So how's your family? Great. And are they all doing okay? All staying safe?
Yeah. I haven't seen any of my family for some while because I live on my own. My son's just the other side of town. I could walk to go and see him in print, but I can't. So we're keeping in touch on Skype, and people are having to these days.
All the technologies are definitely helping everybody out. I've got family in America. We've had passing over there in Coventry. Tech is definitely it's definitely helping out in this situation. You are breaking up a bit, but you're still okay. We can continue on. Let's go through the numbers quickly, if you don't mind. The numbers I'm looking at today was 18,091 have been tested. In total, that's 269,598, which, you know, 250,000. That's quite a lot of people. Positive is 78,991. Unfortunately, people who have passed away is 9,875, and we have 391 cases in Buckinghamshire. So I don't know about Aylesbury. Again, chasing after the director of Buckingham Health to get an interview with them. But I know there's been a couple of fatalities, but again, need to stay home.
Absolutely, and it's been particularly difficult on a weekend like this, long weekend, wonderful weather, time of year when normally we'd be expecting to get together with our families, travel to visit, have barbies with friends round, and we can't do any of that, and that is particularly difficult. But I'm really pleased the way the majority of people are responding in exactly the right way.
Yeah, I mean there is people out there. They are still going about doing it, and I've got to admit, maybe it's just me. I have seen a few young people in a few groups as I've driven past, going to the shop and back, and you know again, it's a minority. It's not all youth. It's not, and there's old people like me. I'm 45, so old people like me. You know, I'm not having a go, but I still got to stress. You know, just because you're young, you're probably looking at it and thinking, and I'm saying this because, you know, my daughter's young as well. I mean, she's 17. My son's 15. So, you know, it's one of those things, you know, that to try and get to them, that it's not that you're, you know, everything's saying that you're fine. You know, chances are you'll pull through fine, but it's actually the older groups. It's bringing it back, and you know, people catching it who are your loved ones, basically, the people who's your family. You know, like I say, my son's going to be 15 in December. My daughter's going to be 18. You know, and trying to make them understand that, come on, you've got to understand the consequences of your actions. And like I say, today I saw a few groups out there, and I'm thinking, you know, no social distancing. They're all quite close, and I'm talking about, I think they're near their 25 to 30 ages. So I'm a bit like, come on, guys and girls, what's going on here? What don't you seem to be picking up here?
Yeah, and I think, as you say, it's not just young people. It's people that should know better, for want of a better phrase.
Yeah.
And the message has been given by government, by the NHS, by myself, by so many sources, and you just think, well, what part of this do you not get? Do you not get how serious this is? And if we have a significant minority of people continuing to ignore it, there's only one way this can go, and that's for tighter restrictions and more of a lockdown and more police action to enforce it. And this is the last thing the police want to be doing. They've got far more important things to do, but it's right that they are showing some enforcement and getting the message home to people that these rules are not there to be ignored or bent, or I'm immune because my circumstances are different to everyone else. That's not the case. Everyone has got to follow.
Yeah. I again can't believe. I mean, I've got the figures that were out today in the press conference. I'm just going to merge it across to show the southeast and how it's how many cases it is in line with the rest of the country. Now just put your mic back on, so you'll be able to see on your screen now. So this is people.
Mm-hmm.
It's only people in hospital that they're reporting on, by the way. It's not all the people. I mean, people in care homes. I mean, I've had a few calls from a few people, messages who work in care homes, and saying people are passing away in there, but they're not recorded. So, I mean, here you can see that the southeast is just above the 2,000 mark, and I mean, Scotland, east of England, Wales, and southwest are below us, but northeast, northwest, Midlands, and especially London, obviously with the density of it. And that's another thing. Don't think it's not here, because, like I said, 391 cases in Buckinghamshire. We are. Oh, my phone's stinging. I do apologise. We, at the end of our line is London, and people come from London to Aylesbury and Stoke Mandeville and Wendover, and to all those other places. So, if you're not getting the social distance, it's not here. It is. I mean, if we just scroll down a little bit more, I mean, the trend. I mean, again, we are following the Italy trend, but from what they said today in the press conference, there is a slight turning, isn't there? I think so. Hopefully, we can. I think it's.
Hopefully, it's probably too early to say. Yesterday and today, over 900 deaths each day, which are the two highest figures we've had. So I think we're still on the upward part of the curve, and even when that starts to turn, that's not the time to immediately relax. We're only just, I think, starting to see the decline in the number of rates of infection in Spain, which had its lockdown a lot earlier than us. So I think there's still some way to go, and we've got to be absolutely vigilant about this.
Well, that's the thing about the curve, isn't it? With the curve, and people saying, just because that starts to turn doesn't necessarily mean we're home free and it's all good. I mean, this is the big thing about the testing and the antibody testing. It's all about, stay at home, because at the end of the day, if you don't, there is a possibility that you can catch it, and then you can pass it on to members in your household. And if you're out and about, you're going to pass it as well. So, stay locked down for at least 14 days. That's what they're saying. But yeah, like you're saying about the trend of the UK, we are following the Italy line. And I mean, United States is, I mean, what they're up to 18,000. It's shown on this graph. So it's not good. So it does take me on to the cemetery, by the way. So obviously there is a lot of deaths, and and I do feel for all the families out there. A good friend of mine, her uncle passed away. So it is prevalent. It is there. The council made a decision just after we had our chat last week, which at that time I think we was yet to 66 cases, which was last week.
Something like that when we first spoke, yeah.
Yeah, so that's a massive jump, isn't it? If you think of it, in a space of virtually 7 days, we've gone up to 300.
Yeah, well, in fact, it's up to 421 today. I've just looked up Inbox, and according to Martin Tett of the Buckinghamshire Council, the number of deaths as at midweek was around 50. So that will have gone up. Yes, there have been certainly 2 funerals in the town cemetery that I've been aware of that I believe are coronavirus related.
Okay. So, 50 deaths in the Buckingham. That's it's sad to hear. So again, so this brings us. That's 50 families and obviously relations that want to obviously pay their respects. And is there going to be any leeway of this lifting this obviously ban on visitors at the moment?
This is one of those quite tough decisions. The town council took advice from the National Association of Local Councils. They said their interpretation of the government guidelines was, well, there's nothing specifically related to cemeteries,
Yep.
but they advised, as a precautionary measure, they recommended we close, and we did that. And I know that's a particularly tough thing. We've had a relatively small number, but members of the public complaining or unhappy that the cemetery isn't open either for their daily exercise or to actually visit the grave of a loved one who's passed away, whether recently or some while ago. But of course, it is difficult not being able to visit your deceased relatives. It's also difficult not being able to visit your living relatives, like my son, for example, or relatives who are in hospital, because Stoke Mandeville have restricted visiting, and I think that's absolutely right. I think we've really got to keep this locked down as much as possible. I will talk to the town clerk of the town council whether we think there is any scope for changing that decision. I think probably the majority of councils are closing their cemeteries to visitors, but a reasonable minority are not doing so. So I think it comes down to each council's individual judgment, really.
Yeah, could the council be looking at some kind of like booking system where obviously, because you've got to keep the numbers down, you want to keep the social distancing done, you know, so at least, again, not 2 meters, at least 2 meters. I must reiterate it to quite a few people, it's at least 2 meters. Is there, I mean, like working with the church network, and maybe, you know, people can volunteer to obviously make sure that it stays within those realms of only certain people can come in and you keep the numbers down. Is that something that maybe is a possibility? The only reason I'm saying it,
I don't know, Martin. I'm thinking about the logistics of how the cemetery normally works. It's actually not just someone unlocks the gates in the morning and locks them at
no, it would have
dusk.
hand, wouldn't it? Yeah.
Someone has to be on hand or on call if there's an accident or something. There are public toilets in the cemetery. Obviously, they have to be regularly cleaned. Even more so, they have to be very regularly cleaned, very thoroughly cleaned. Otherwise, that's another risk to the public who are touching the taps and handles in the toilets. We can't be taking risks like that. So it's all of a sudden you're talking about having manpower diverted from other work that's going on for the council into the cemetery to make sure it is a safe place. And then how do we ensure people are keeping social distances? The paths through the cemetery are quite narrow. I think if, for example, we had opened this weekend, because other parks and open spaces are closed, you might get quite a large number of people wanting to go there, and that all of a sudden becomes a potential difficult situation. So there's no easy answers to things like this.
I'm sure there isn't. And I mean, again, asking the question, people have spoke to me, and it's just relaying across. I understand that you're in a no-win situation. If you open them, people are going to say you shouldn't be opening them because you're taking resources away. And if you don't open them, you've got the people obviously saying, why aren't you opening them? You know, so totally understand that. But maybe it's just, maybe people can, you know, comment, let us know, maybe to yourself or even to me at FBL Broadcasting, and you know, we can obviously chat through that maybe in an update next week or something. But I'm sure you'll speak to Martin Tet and the rest of the wonderful people working within the council, and maybe you can come up with an idea or maybe something. At least that's something we can look at. And
we're always listening.
Yeah, always. As always, not as always, but today we are on a bit of a time frame, so I would like to dedicate a little time to your charity, Mayor, if you don't mind, which is Youth Concern. So if I can just going to block you out and put the little logo up, the little logo, quite a big logo. So just so people can, if they see that logo, it's Youth Concern, you're backing that, obviously in your term, which does bring us on to another question, obviously being Mayor Day, but do you want to tell us a little bit about Youth Concern?
Oh, happy to, Martin. So, Youth Concern is the charity I adopted in May last year when I became mayor. They are Aylesbury based, and they look after young people in the age range of 13 to 25 who are going through really difficult and challenging circumstances. Some are homeless, some have mental health issues, some have a really, really troubled family background, and Youth Concern's doors are always open. They, well, the doors aren't open at the moment, which I'll come on to in a minute, but they normally run a drop-in centre, face-to-face counselling, support for young people to see them through their issues and get them back into work, stable family life, and contributing to society. Now that work is continuing. They are doing a phone and online triage and counselling service, and I think they're managing to reach out and meet the needs of everyone who comes to them, which is absolutely tremendous. It's a real challenge for all charities to continue providing their services, particularly one for like Youth Concern that really, really does rely on face-to-face contact most of the time. It's really good that their work is continuing. What's a little bit sad is that a number of the events the Town Council would have been having last month, this month, and into the summer would have been partly geared towards raising more money for Youth Concern. I would have been at all those events shaking a bucket or a tin. So here I am metaphorically shaking a bucket to ask if anyone out there would like to continue supporting Youth Concern. On their webpage there's details of how you can donate to them, or you can do that through me and through the Town Council, just to help their vital work carry on through these difficult times.
I don't know what else to say to that. Yeah, that's quite a load of information there, and it's again very interesting because you're not doing these other events. It's actually going to have a strain on them, isn't it? As in financially, as in the money raised. So if people can,
yeah, I think all of our events. I mean, they're partly to provide events to entertain the public, but there's always an element of trying to help the charity, which is, one of the things I'd most like to do in my term as mayor to the maximum degree possible. That's been slightly stalled. We're looking at possible other imaginative ways of getting some funding into them, but anything the public out there can do to help would be really appreciated.
Okay, yeah. Again, maybe we can put a link on that on our comment bits, maybe to some of I'll put the web page up so people can actually see that. Put a little link there. If you can send that through, we'll put it on there, and hopefully some people will donate to you, especially for the time that you broadcast on FBL Broadcasting. It's really nice that you do that. Giving up time and sharing some information. Quick, we've got about a couple of minutes left. Mayor Day. So, question came to me a little bit earlier. I thought, when is Mayor Day?
Okay, well, the calendar says that the council meeting, when I would step down and hand over to a new mayor, is on the 21st of May, and the ceremonial mayor making, when that formal handover happens, was set for the 5th of June. Now, neither of those are likely to happen. The council meeting may well take place remotely with all the councillors dialing in or using something like this. Yeah. So feel for me, I have to chair that meeting with 25 people all dialing in from different locations and mastering new technology to most of us. We don't know. We're having discussions within the council as whether in these circumstances some people think it might be an idea, for the sake of continuity, that I carry on for a bit longer as mayor, and then we do the formal handover in the more traditional way when we're able to, when things have got back to normal. But we're reaching out to all the members and talking to them about what's the most appropriate way to do this, and we'll let you know when we've come to a decision on that.
Okay, please do. So, technically speaking, could be in the record books as the only mayor to last 2 terms. Is that correct?
Not the only. In the past, mayors have done longer terms. It used to be quite common to do 2 years, but that's quite difficult, especially when people are in full-time work or got families. So it's a year these days. It's possible mine might stretch to a little bit more than a year. Whether it'll be a full 2 years, I'm not sure. I've done 10 months and it's been quite exhausting already, so I'm not sure how I'd be able to get on with that.
That's another thing. You do have a job, don't you? A full-time job, as well as doing the mayor work. So it is a lot of work. And like you say, we thank you. I'm sure loads of people can also thank you as well, because it is something that you do out of the kindness of your heart. And you could get a little bit of a longer sentence, so to speak.
Well, if that is needed to help us through these differences, I'm happy to do that. If people feel that I am the right person to carry on doing the job, I'll be very honoured if that's the case.
I think they would, Mike. So, again, we've run out of time. Thank you so much for giving us your time and how valuable it is. And hopefully we can catch up again next week. Have a good Easter. It goes to the same as everybody else out there. If I could just whack a little thing on, which is if anybody does it, well, if they don't mind, as they say, if I can do this right, just subscribe to us on YouTube, like us and follow us on Facebook. Be greatly appreciated. Give us any comments, and I'm sure Mike and me can try and sort something out to answer those questions. So, Mike, have a good Easter. Everybody else have a good Easter, and stay home, stay inside.
You too, Martin. Thanks very much.